Diabetes mellitus type 2, created by Megan
and Martha. Disease processes. Diabetes results from a deficient production of insulin by the beta cells in the pancreas, from resistance of the body's cells to insulin or both. When glucose is unable to enter body cells, it stays in the bloodstream. Hyperglycemia results, and the cells are denied their energy source. Abnormal glucagon secretions also play a role in type 2 diabetes. As the disease progresses, insulin production diminishes. Eventually, the pancreas will wear out and lead to no insulin secretion. Signs and symptoms: polyuria, excessive urination; polydipsia, excessive thirst; polyphagia, excessive hunger; fatigue; blurred vision; headache.
Some risk factors for type 2 diabetes is going to be age 35 and older, those that are American Indian, Black or African American, Hispanic or Latino, or Pacific Islander, those that are overweight, or those that have obesity with at least one other risk factor, and a woman who has had gestational diabetes is also at risk for type 2 diabetes. So these are just some diagnostic testing that you can do to check your blood glucose. One of the most common tests is the A1C test. That is a blood test that provides your average levels of blood glucose over the last 3 months. It's not a test that you have to fast with. There's also fasting plasma glucose. There is a random plasma glucose test. This test can be done at any time. It's something that the doctor does when they don't want to wait for the patient to fast. You also have a glucose challenge test and the oral glucose tolerance test. Both of these tests can check for gestational diabetes. However, the glucose challenge test is specifically done on pregnant women. The oral glucose test can help detect diabetes, prediabetes, and gestational diabetes. And that's the test where you drink the really sugary drink, and then you get your blood drawn 2 hours later, unless you're pregnant, and then you get your blood drawn every hour for 2 to 3 hours.
This is a table here that shows test results for diagnosis of prediabetes and diabetes. So it has your ranges for normal, prediabetes, and diabetes. And the ranges are for the A1C, fasting plasma glucose, oral glucose tolerance test, and the random plasma glucose test. The next couple slides are medications and medical treatment.
You want to remember your ABCs when it comes to diabetes mellitus type 2. A stands for A1C of less than 7%. B stands for blood pressure of at least 130 over 80. C stands for cholesterol. You want to keep checking your lipid panels. And S is for stop smoking. Don't do it. This is a table in regards to the treatment plan for type 2 diabetes mellitus. One thing you want to do is lifestyle modification. So you want to eat a balanced diet. You want to include more fiber-rich fruits and vegetables, brown rice, brown bread, whole wheat. You just want to stay away from anything white. So you want less carbs, less pasta, less sugar, less soda, less candy. You want to exercise at least 150 minutes a week of aerobic exercise, or you can do resistance exercise 2 to 3 times a week, such as yoga or weightlifting. As far as medications go, I'm only going to discuss the insulin right now. The insulin is usually given when it refers to the basal insulin for insulin that's given during fasting periods. So it's given, for example, before bed to help the patient while they're sleeping to maintain their glucose levels. You also want to keep up with your glucose monitoring. So every 3 to 6 months, you want to have your HbA1c test checked. And you also want to keep up with finger sticks daily or multiple times a day, just depending on your treatment plan and your doctor's orders. This is just a list of some more medications for diabetes mellitus type 2. We have metformin, which reduces the amount of glucose produced by the body. Our sulfonylureas helps the body to produce more insulin. Our glidosomes strengthen the effect of the insulin made in your body. Our glinides increase insulin production in the body. Our gliptins stimulate the production of insulin, and our glyphosins cause more sugar to leave the body in urine, lowering blood sugar levels.
Question 1. A nurse is caring for a client with type 2 diabetes. Which of the following are common signs of hyperglycemia? Select all that apply. A. Increased thirst. B. Frequent urination. C. Sweating. D. Blurred vision. E. Cold, clammy skin. Answer is A, B, and D, increased thirst, frequent urination, and blurred vision. The rationale behind that is signs of hyperglycemia include polydipsia, polyuria, and blurred vision. Sweating and clammy skin are signs of hypoglycemia.
Question 2. A client with type 2 diabetes is started on metformin. Which lab value should the nurse monitor most closely? A. Sodium. B. Hemoglobin. C. Creatinine. Or D. Potassium. The correct answer is C, creatinine. Metformin is cleared by the kidneys, so elevated creatinine indicates impaired kidney function, which increases the risk of lactic acidosis.
Question 3. A client's recent lab results show the following: HbA1c 8.3%, fasting glucose 175 mg over dl. What is the most appropriate action by the nurse? A. Encourage the client to stop taking metformin. B. Document findings as normal. C. Reinforce lifestyle modifications and notify the provider. D. Instruct the client to decrease carbohydrates intake for 1 day. The answer is C. Reinforce lifestyle modifications and notify the provider. The rationale behind that is the HbA1c above 7% indicates poor glucose control. The provider may need to adjust medications.
Question 4. A nurse is educating a client about the importance of regular blood glucose monitoring. Which statement by the client demonstrates understanding? A. I will check my blood sugar once a week if I feel okay. B. I don't need to test if I'm not taking insulin. C. I should log my readings and bring them to appointments. D. My blood sugar doesn't change much, so testing isn't necessary. Correct answer is C. Keeping a blood glucose log allows the client and the provider to evaluate patterns and adjust treatment as needed. Clients not on insulin still benefit from regular self-monitoring, especially if taking oral hypoglycemics. Infrequent testing can lead to unrecognized highs or lows.
Question 5. A nurse is teaching a client newly diagnosed with type 2 diabetes mellitus about dietary management. Which of the following statements by the client indicates a need for further teaching? A. I will try not to eat meals at the same time each day. B. I will include more whole grains and vegetables in my diet. C. I can skip a meal if my blood sugar is in the normal range. And D. I will limit sugary drinks and desserts. The correct answer is C. Rationale is skipping meals is not recommended for clients with type 2 diabetes, even if blood glucose levels are normal. Doing so can cause fluctuations in blood sugar levels and increase the risk of hypoglycemia, especially if the patient is taking medications such as insulin or sulfonylureas. The other options reflect appropriate dietary choices and habits.